Hello, I am Dr. Amir Jaffer, Fellow of the Royal College of Physicians, London. I'm talking to you today about stroke, a disease, and the risk factors, the symptoms, and the presentations to the patients. I will say that stroke is a disease for elderly. It could happen at any age, however. It could happen even in children. There are many risk factors behind stroke. I always tell my patients, and I'm working in stroke unit in Newport, that stroke is a preventable disease. In fact, one of the major and the most common risk factor for stroke is high blood pressure. I would rather say hypertension in medical term. Blood pressure, if it is high, it can cause problems with cardiovascular diseases. And by cardiovascular diseases, I mean the heart disease, and the blood vessels. And part of that, it can cause stroke by encouraging the formation of a blood clot in the blood vessels, in the small blood vessels of the brain. So accordingly, stroke is a disease resulted from a clot formation in the blood vessels of the brain. And this is what we call ischemic stroke. 85% of stroke actually happens due to ischemia or blood clot originated inside the blood vessels of the brain itself because of the formation of the plaques, and that's deposition of lipid into the lumen of the blood vessel. But sometimes it can happen due to the emboli or a clot originated from the heart when the heart is diseased or the valve of the heart is diseased. And this emboli can dislodge itself from the heart valve to the small blood vessel in the brain and can cause emboli or ischemic stroke. And that leads to the interruption of the blood supply to the brain cells and can cause the death of the brain cell itself. And the 15% of the stroke could happen due to the brain hemorrhage. A brain hemorrhage happens because of the rupture of the blood vessel supplying the brain with the blood. And this rupture of the blood vessel can happen due to the high blood pressure in most of the cases. That's why when patients come to the hospital with the brain bleed, with the brain hemorrhage, the first thing we do is to check their blood pressure and try our best to control the blood pressure itself. But it could happen due to the aneurysm or dilatation is a small pouch formation from the blood vessel of the brain filled with the blood. And that, again, can be easily damaged and cause problems in brain hemorrhage and bleed inside the brain. These forms 15% of stroke. So stroke can be due to blood clot or could be due to a bleed in the brain.